And now I'd like to ask Professor Abdelman Al-Musager to give us his perspective on, again, the policy issues, the successful stories, and the bottlenecks.
Bismillah ar-Rahman ar-Rahim. I'm going to speak very quickly about some issues that are important for the policy and programs. Many people, they mention about the dietary habits and unhealthy diet, but they forget something about skipping breakfast. I didn't see anybody mention skipping breakfast, and this is very important related to the obesity, related to many diseases. Other important thing, when we say fast food, many people, they believe in our country that Western fast food. No, we have our local fast food. And it's a problem with our local fast food, shawarma, falafel, there's so many things because of the fat and cholesterol. So these things should be very important to be included in anything regarding the dietary habits. Other thing is training of the doctors and nurses. Dr. Ayub, he mentioned about training of the primary health care. No, also about in the hospital. Doctor and nurses, they are very key persons and very important person to transmit the information. And the problem, training of the nutrition management of the non-CD is very important things. So we have to focus on the training of the doctors. Other important thing, working with the food industry. If you can't beat them, join them. Food industry, we can work with them. I give you example now we see in Bahrain. In University of Bahrain, they asked me now to help regarding the fast food restaurant in the university. So I told them, okay, fine. Let's collect the manager, and we sit with the manager of the fast food in Bahrain. And I asked him one thing, can you stop selling the large size only? So I asked him for the double burger, large size of the soft drink, and large size of the French fries, to stop selling to the student. And they stop it. And we save 200 calories for each student per day. So you can do something very simple, sit with them. And especially that's in the university. The other important thing, when we mention salty food, trans fatty food, okay, fine. But we don't have information about our local food. We don't have information about the composition of the local food. We have to work on this thing. Rightly saying what they said before, that the bread in the Arab Gulf countries contain high amount of salt. And we analyzed this thing and found it. So we have also to encourage the research and the food composition. I will not go more. I will speak about socio-cultural factors. This is another problem. We always focus about dietary, physical activity. Cultural factors is very important. Barriers, there's so many barriers among women, among people. So cultural factor is very important in our area. Other important thing, the efficient utilization of the mass media. The problem with the mass media, all the programs about education in the mass media, they are classic. Bringing some doctors, speaking with them, ask them. And this is boring. We have now 700 channels, we can go anyway. So we need some attractive and also updating information in the mass media to educate the people. Last thing, many people, as they said, banning of the food, banning something. You cannot ban, you can regulate. So please regulate, but don't ban. I will stop here, thank you.
Thank you very much. Important messages, concise and very useful. Let me give the floor to Dr. Ayed Al-Khattani.
Thank you so much. I will be talking just practical. I'm a surgeon, and my background is surgeon, and I will not be talking a lot. And I think nobody will disagree that we have strategies, we know what is wrong, we know what is right, we know what is evidence-based, and we know what works and what doesn't work. But the problem, we don't know how to implement it and how to execute it. And if we look to our country here, and the Gulf state is not different, and I think the Middle East is similar, that the problem is distributed in different levels and different environment. The schools, we know, and we admit it ourselves here in Saudi Arabia, we are not providing healthy food at school. And we cannot even, if you look chips and other, they are provided, they are sold to our students. Unless we change this, and unless it is through legislation, we can say it, and we can finish this meeting with an excellent declaration and excellent strategies, as it is done everywhere, and almost every year and every 6 months we have strategies, and there is no state, no country without strategies. Nowadays we read it everywhere, and we click as a mouse or so on the internet, and we'll find all strategies there. But the problem, it's not implemented. And the only way is to have multidisciplinary, some sort of institutions working together under one legislation from the higher authority and the government. In the school, there should be healthy food, and we don't have it currently. As this roundtable is about the current status of dietary problems in the area. And if we move out of the school, and if you look to the environment around the school, and it is applied somewhere else, and we know it's part of the strategies, and hopefully we'll include it in our strategies, that there should be a good distance between restaurant and fast food restaurant and the schools. Now they are almost close to the door and the neighbor where the students can come and get the food from there. Restaurant, their choices are not healthy, and as Dr. Musaker mentioned, sure, we will be able, but not by individual work. We cannot go there and ask them to change this and that. There are some studies, and we have seen the evidence-based, that by only simple and light legislation, things will not work. People would like to gain money from this restaurant, and they don't care about the legislation unless it is very strong and there is some sort of link problems with that. So this is about restaurant and their portion size, the soft drink, the juice, where all legislation, and we know the evidence based on that, and salt and everything. We don't need to repeat these things because we know it. Everybody say it and we know it, but how to make them executed. And executing it through clear legislation with clear implementation. Now, home, I think this is where it comes to awareness in the media, in the schools, in the universities, in wherever we can tell the families how to provide healthy environment at home. And our effort at King Saud University Obesity Chair, where we developed some booklets, something that the mother and other members of the family, they can use it at home as guidelines. Public and institution, if we are here and the hospitals, which are supposed to provide the care to those disease patients, are providing unhealthy food, what do we expect? Others who are not really providing the care will provide the healthy food? No. We should start by implementing these even in the very clear, obvious place that should provide the care, which is the hospital, the health providers, places where should be providing some sort of healthy food and will be the role model for others. Media, I agree, we have a problem with the media, as Dr. Musaker and others mentioned, and the media here in Saudi Arabia, unless there is legislation clearly stated. We know there are government media or linked to the government, and there are media which is public, and unfortunately you cannot control them easily, but you can control the country and make sure there are certain time where there is no ads for unhealthy food for our kids, which is unfortunately they are really targeting their exact time or the prime time. The food industry, we have been in a meeting with many, like in Obesity Society and others with the food industry, and they are honest with us. They said, we don't gain much from healthy food. That's very clear. We gain from other food that are unhealthy. So unless there is some legislation, we will be accepting the marginal benefit because there is a big difference between these. So I think we should partnership with them, but in a way under legislation, as has been mentioned in the presentation, with certain rules and regulation, maybe here in King Saud in Saudi Arabia, where they have a Saudi Food and Drug Administration, taking the precedence to control all food and others, they will be able to apply this with food labeling and quantity of trans fat, quantity of salts, all these issues to be applied. And food market, I think it's very important also, where we make sure there is food labeling in our area. And unless we have the legislation for applying these items, we will not be successful. We can say a lot of theories. You have every nice, excellent single strategies, but unless we have it there implemented with a clear legislation to implement it and a clear people to execute it and search to make sure it's executed, our meetings and our declaration will not be of that value. Thank you.
Thank you, Dr. Al-Qahtani. So you've heard many policies, many different actors. I don't think we have necessarily the same view on how to deal with the private sector, for example. And Dr. Al-Qahtani just mentioned the importance of settings. So we need to implement these policies in different settings. But now I'd like to ask Dr. Rowana to speak about one particular setting, which is the schools.
Thank you. Thank you very much. First of all, I'd like to thank Dr. Aid Al-Qahtani very much for laying the groundwork for my talk, because he mentioned a lot about interventions in schools, and that's exactly what I want to talk to you about, the need to focus on interventions and the need to focus on the schools. We all know that obesity is growing in the kingdom, particularly among kids and youth. Therefore, there's a need for intervention and how to intervene except through the schools. The schools serve as the perfect platform for an intervention. And that's what we actually did at Saudi Aramco in partnership with the Ministry of Education under our Corporate Social Responsibility Program. We went ahead and partnered with them to develop something we called the Safir program. Now, the Safir program, in a nutshell, is a program which aims basically at empowering 13 to 15-year-old students on becoming ambassadors of health and well-being in their schools, along with their trained teachers, to spread the word of health and well-being and to be able to function as positive peers rather than negative peers, exerting positive peer pressure. Now, the name Safir is particularly important to us because in Arabic, we all know what Safir means. It means an ambassador. But in English, it's actually an acronym for Saudi Aramco Peer Health Education and Reinforcement Program. So the students who graduate from the Safir program are actually ambassadors of health and well-being, and that's an identity for them. During the Safir program, what we did is we worked with the Ministry of Education to identify governmental schools that we can start working with in the Eastern Province. We worked with 10 boys' schools and 10 girls' schools the first year. We identified teachers in those schools that we can train as mentors on how to supervise the Safir program in their schools, because we understand that our capacity as an organization, as well as other organizations, is very limited in the amount of outreach work that they can do. So the best way to start is by training the trainers, by disseminating the knowledge that you know in order to train others on how to sustain that program. So we identified the teachers and trained the teachers on how to supervise the program in their schools once it's up and running. Then the teachers worked with us on selecting specific students which met certain criteria. For example, good grades, popular, already healthy, and of course their parents consented to the intervention. As such, these students were trained as ambassadors or as Safirs of health and well-being. They were given 5 different modules. Healthy eating, nutrition was only one of them. Move it or physical activity, tobacco use, life skills, and peer skills, or how to become a Safir. So we went to each school for a period of 2 days. On the first day we delivered some of the modules. On the other day we delivered the rest of the modules. Now, as a result of the training, the teacher had to work with each individual student on developing an individual health promotion program. It could be targeted to any of the modules I mentioned. But we did notice that most of them were targeted around nutrition and healthy eating because apparently it was a concern of theirs. And in turn, they had to develop that project with their mentors and then deliver it to their peers at the end of the year. And in turn, we were there at the end of the year to be able to evaluate, to monitor and evaluate the delivery of the project. We trained around 220 male and female students who were able to deliver the peer program to 30 students each, so that if you do the math, that's a huge number of students that we were able to get to through the Safir program. Now, what we noticed at the end of the year when the students came back with their teachers and delivered the module, we noticed that a lot of them brought their parents in and also involved the parents in the projects. So it turned from a school health promotion program to a family health promotion program to a community health promotion program, which ensured that the message was incorporated and engraved within the families themselves. Now, we conducted an evaluation of the program and found out that there was a really significant increase in knowledge across all the modules, especially the life skills module. And the life skills module basically gave them the skills on how to incorporate the different health promotion aspects into their life, such as time management, decision-making, problem-solving, communication skills. We found the least improvement in knowledge in the tobacco use module, and that's perhaps because all the information was already there. But we found a significant improvement in the nutrition module, which we called Healthy Eating for Life module. Now, one of the drawbacks of the pilot program is that we hadn't incorporated a methodology for evaluating the program on the long run to see the change in behavior on the long run. So as a result, we're relaunching the program this year with the revisions, with certain revisions to the program, such as incorporating a long-term evaluation, as well as continuing to work with the Ministry of Education to be able to launch the program in other schools across the kingdom. We hope to be able to hand the program over to the Ministry of Education in around 5 years so that they can independently carry it out. But the outcome is that the best way to be able to get the message through to a significant portion of the population is to involve them in the teaching process and involve them in the implementation process, because only that way will it be engraved in them and will it sustain itself. Thank you.
So, thank you, Dr. Rana, for these positive messages, encouraging. I'd like to ask, just last but not least, Dr. Al-Saif. He will tell us about some of the bottlenecks he believes that we have in the implementation of these policies.
Thank you very much. Happy and glad to be among you today. We are talking about the diet and eating behavior changing in the region, and I will be emphasizing more in the changes that happen in Saudi Arabia. Whatever situation we have now is the result of changes that happened around 30 to 40 years ago when the country started to be changing from closed small communities to open multi-cultural, multi-sectoral. People start moving and traveling from rural areas to urban areas as they are becoming a development hotspots. With that, large number of expatriates coming from different countries of the world joining the Saudis in their development of their country. The influx of wealth to the country, the opening of the market to import any basically any food they would like to import. The trade is free in the country, and they can import the food item they wish to have. These are among the many factors that pushed to in the direction of changing the diet and eating behavior of the population. Many years ago, there used to be very limited number of food items that are available for people. They used to eat regularly. They used to eat as a family. They are, this is almost all of their diet and eating behavior uniformed in a certain shape and level that has been given to them down from their parents and their grandparents. What happens in the last 40 to 30 years, the country opened to so many different factors that affect eventually the diet and food they are eating. The consumption of the different food items, or let's say the availability of different food items in the market increased dramatically with the open exporting policy. The availability of food per capita increased in the last 30 years dramatically in the different food items and food groups. People start consuming in the beginning the different food they receive or they see for the first time of their life. Eventually, they develop taste to certain items or certain dishes or cuisines. The effect of the, let's say, globalization of Saudi Arabia has eventually had the toll in the health of the people with the increase of the non-communicable diseases, including diabetes, obesity, and other conditions. This problem of non-communicable diseases that is originally or originated itself from food is a result of at least 3 decades of changing the diet behavior and eating behavior of the people. And to solve that or to correct that wrong, if there is something to be corrected, which is in this case a lot, we need to give the solution time, meaning the country has to, or the country which means the Saudi Arabia and neighboring countries, has to have national nutrition policies that set goals for the next 10 years or 20 years. Whatever it took 30 years to happen, it needs at least 10 years to unhappen or to have something much better to offer to the people. The nutrition policy, one nutrition policy come to mind that had been implemented in Saudi Arabia a while ago, when the Ministry of Education banned the soft drink from the schools. Maybe it was the right thing to do at the time or not, but this is an example of having a national policy that will affect almost every individual in the country. Another international example come to mind, having probably it is the Denmark government having a fat tax. When the fat component of the food increased, then the price comes up also, and that comes as a fat tax, they call it. The community need for programs is extremely essential. However, there is a need to have a coordinate effect within the country from different ministries, different entities that will synergize their efforts and help them reach the goal in a more effective way that will help people reduce eventually the non-communicable diseases among the population. I would have elaborated on that issue more, but I will give time for my colleagues or the audience to have a discussion about the issue. Thank you very much.
Thank you very much. And we'll now give the floor to you. So we've heard about what we need to implement some of these policies. So I didn't hear major disagreement. We have some, again, bottlenecks on some of them. We need to know more about foods. We need to have a bit more capacities in the health sector, in other sectors. We need to interact more with the agricultural sector. We need to consider the cultural changes that have taken place, and we need to see how the food system is evolving. So how do you react to these issues? Gentleman in front who has the microphone. Why don't you, yeah, while the microphone comes, maybe you can introduce yourself. Yeah, in front.
Thank you for this discussion. My name is Dr. Bushra Al-Bashir, Consultant Medical Nutritionist, Minister of Health, Kingdom of Saudi Arabia. We observe that most of the resources and capacity is directed to the treatments like diabetes centers, renal centers. I recommend that there should be a national nutrition center in each country. This center should cooperate with the private center and with the university, and should be the body that can implement most of the nutrition policy and procedure. Unfortunately now, as you know, most of the nutrition policy is not being implemented, not by the doctors, not by private sectors like the rest of us. So I recommend that one of the recommendations should be there should be a national nutrition center to be responsible about this issue. Thank you.
Thank you. Please.
Thank you very much. My name is Mohamed Hassairi from Tunisia. In Tunisia, we are going to implement a nutritional strategy. Until now, we don't have experience, very experience for implementation of this strategy. My question is to Dr. Branca for reduction of salt and trans fat acids. Is it better, according to your experience, to make legislation for this topic, or to just make labeling and increase taxes if recommendations are not respected? Thank you.
Thank you. I suggest that we take a few more and then maybe we ask the panelists to respond. Please.
Thank you very much indeed. I wanted just to comment about the end of what you suggested about policies and guidelines and so on. The problem now, we have our children in the schools, they are becoming fat and no control of this one. Why we don't, for example, adopt or promote something which we call healthy fast food? There is anything such as this fast food which is healthy to be advised, because I know that our children, they read about what they need to eat, but they excessively eat more than needed. This is one. The way we eat in Saudi Arabia, we eat fast, and there is so many applications that fast eating creates diabetes. There is strong relation between eating fast and so on. We lack of exercise. We should emphasize that each place or each region in Riyadh and cities, they should really make us a place where we can walk. Here in Riyadh, you can't walk actually. You can't walk. There is no place to walk. There is no gardens in each area. And all this actually is a vicious circle, is related to each other. After this one, and the end of my comments actually, we know that the end stage of obesity, it's not only diabetes and so on. There is a sleep apnea, car accident, nodding off during driving and so on. It's related also to overweight and morbid obesity. And cardiac sudden death and so on, which is related also to obesity. Why we don't advise the relatives or the parents of a child who is above 14 years old to have what we call it volume reduction surgery, what is for the stomach, or to at least prevent him from eating too much. Because the Ministry of Health, it will treat when it's happening, but prevention, it doesn't work. I think we should really think about more drastic, about exercise, about how we can eat, what we eat, and if no resolution about this one, we should advise the parents to have partial gastrectomy, for example, for a child who is 18 years old. Thank you.
Okay, so you're bringing a very new dimension in addition to what we've been discussing about preventive policies and creating a healthy food environment. You're saying, okay, let's correct what we have already. Please, we have here and then the...
I am Abid from Tunisia. My question about natural food production is for healthy eating is very good because interact with regulation and reduce diabetes and syndrome metabolic, etc. But my question about industrial food production and worldwide industrial food production to our countries. The problem is to change laws, import, export and taxes for this region is not very easy, not easy. And there is a lot of and high import of this food, industrial food, not healthy industrial food, and with higher sugar, higher fat, and higher salt. So what the solution for this problem?
Thank you. Okay, I need to, we are a bit short of time, so I'd like to give the floor to our colleague there, and then we'll ask the panelists to maybe give a brief answer.
David Matthews, I'm Professor of Diabetes Medicine in the University of Oxford, UK. You've heard a bit about labelling, and I'm keen on labelling. I think it's a very good way to help people make decisions, and it doesn't force people into any particular corner. But one of the things that one ought to think about in labelling is calorie labelling. You've heard about traffic light labelling, but traffic lights divide things into red, amber and green, and actually you only need 2 thresholds. So it's sort of saying that there's just 2 thresholds and you can do everything on that. But we used to eat red meat a century ago, and we used to eat butter and so on. What the difference is not necessarily the content of the food, but actually the quantities that we consume. You've already heard the data from this region of people eating 3,000 calories a day. And actually, if you label things carefully, people will start to notice those numbers. Actually, you don't even need an education program, because people know that they need to reduce the numbers of calories, and so they can see that something that contains 200 calories is going to be better than 400 calories. So I would think carefully about what you want to put on to food labeling, and calories is one way that you can actually try and encourage people to consume less. Incidentally, since fats contain very large amounts of calories, if you get the food industry to try and reduce the number of calories in their labelled products, they will actually reduce fat as well.
Thank you. I think this is really an interesting discussion, but I think with the permission of the chair, we have to unfortunately cut it here. So I'd like to ask maybe just a very quick series of reactions from the panelists, and maybe I'll start from Graham. So Graham, what shall we do, as the colleague from Tunisia asked about salt? Is it necessary to legislate?
No, I don't think it is. I think the point we must get back, the food industry is killing us by putting too much salt, too much saturated fat and trans fats and too many calories. And they realise that now. And we have to realize we're not trying to get rid of the food industry like the tobacco industry. We don't want to destroy the food industry. We want them to make their products more healthy, and we have to engage with them. And they're very powerful. They're the biggest industry in the world now, bigger than defense. So we have to go with some humility. But the fact is that they realize they're killing consumers with their food. They have no interest in killing people, because dead consumers do not eat food. And if they produce more healthy products, people would live longer and they would make more profit. So the fact is the food industry has a great interest in making more healthy food, and the way to do it, in my view, the short fix is reformulation. Get the salt intake down slowly, get the sugar in concentration down slowly, take out saturated fat, don't substitute. Take it out. You can do that by 10 to 15% without altering the quality of the product. And if you then work out the calorie reduction you'd get from a 10-15% reduction in saturated fat and a 20%, 30% reduction in sugar, which you could, that would have a huge impact on obesity and cholesterol. And the salt will have a huge impact on blood pressure. And I would advocate to all of you engaging with the food industry to make more healthy products with less salt, less saturated fat and less sugar, and smaller portion size to reduce calories at the same time. Thank you.
Dr. Al-Musager, can we make healthier fast food in this region?
Even the fast food is divided to the healthy and the unhealthy. Some of the fast food is healthy. I'll give you an example. If you take grilled chicken with brown bread and no mayonnaise, no cheese, it's healthy. So we can make these things, but there is, I want to do something, to say something regarding many of the suggestions and many of the plan of action, many of things. Please don't dream. Dream is a dream. Start with something is better than nothing. So start with the simple things now, because the problem is very big and it's going to be bigger and bigger in the future.
Dr. Al-Khalil, can we have enough fruit and vegetables for the people in the country?
In fact, really, I think the consumer has the right to have organic products in the shelves, in addition to conventional and GMOs. And finally, we will leave the choice for the consumer when we at least convey the message to him what's good for him to eat. This is one thing. The other thing related to fast food, I think we started here in the region, for example, in Dubai and even in Bahrain, we started some sort of organic food and cafe. We started really to do that. It's some sort of fast food, but it's organic and healthy. I think we can do it, but we have to encourage, because you know, the motivation is the demand. We have to increase the public awareness campaign for the consumers to know about the benefits of healthy food.
Thank you. Dr. Al-Jawaldeh, what do we need to do to produce these nutrition policies that was suggested?
I think we are progressing very well at regional level in terms of policies. We already have a regional nutrition policy. It is really very comprehensive. It has an action plan. You can easily adapt it to your countries. And the good news that we are working with member states, and so far we developed about 19 strategies for 19 countries out of 22 countries. I think there are 2 or 3 countries still behind. So we are working with them to develop the strategy. But as we said, the strategy should be developed through a participatory approach. All the sectors should be involved. All the key partners should contribute to the strategy. And the most important thing is to have a commitment from the policymakers. Without having a commitment from the leaders, we need a leadership and we need a budget line, because if we don't have a budget, then it's difficult to implement the strategy. And this is, I think there are many countries are progressing very well and they are really contributing in this direction. And we are ready in EMRO to facilitate developing a strategy for any countries still if they don't have any policy or strategy. We have done it, and I think we have also strong support from Dr. Branca from Geneva. Thank you very much.
Thank you. And Dr. Al-Saif, do you think it's difficult to have policies to affect import and export in this region? I mean, is that trade element difficult to handle? What do you think?
Change will not be difficult, however, it needs to be slow, so it will be absorbed by the target audience or the population. Policies is needed for the future to be planned or to be at the right foot with regard to food consumption. Currently, we have the perfect prescription for non-communicable disease morbidities. We have high salt consumption, high sugar consumption, high fat consumption, low fruits and vegetables, low fiber, and the different entities are pushing it. I am with engaging the industry, but the industry always need to be pushed a little bit by the governments, and that comes through policies and rules and regulations. Thank you very much.
Thank you. And I think we have been discussing a lot, bit late. So I'd like to thank you, all the speakers and panelists. And now I'd like to give the floor to His Excellency for the closing remarks.
بسم الله الرحمن الرحيم. أشكر كل الإخوة والأخوات المتدخلين. تبين من خلال المداخلات هذه أو التي كانت في الصباح أن الطعام يقتلنا ربما أكثر مما تقتل الجيوش، ولذلك علينا أن نخوض هذه المعركة بكل تركيز حتى نربحها باعتبارها تهدد مستقبل المجتمعات العربية. ولا يمكن أن ننتصر في هذا الجهد إذا ظل كل وزير وكل سلطة قرار تعمل وفق أهدافها الخصوصية. وزير الصحة يبحث عن توفير الأدوية والعلاج، وزير الفلاحة يبحث عن إنتاج أكثر مهما استعمل من أسمدة بطريقة سليمة أو غير سليمة، وزير التجارة يحاول أن ينمي الأرباح إلى غير ذلك. لا يمكن أن ننتصر في هذا الجهد إذا اعتمدنا على استراتيجيات جزئية ومتضاربة. وزير الصحة كما قلت بالأمس يشتكي من التأثيرات السلبية للسكر، ووزير التجارة يبيع السكر مدعوما. فلذلك لابد أن نوحد السياسات وتصبح القضية قضية أمن وطني، تصبح القضية قضية أمن وطني مرجع النظر فيها هو أعلى السلطات في البلاد. ويصبح ربما من الضروري أن نضع في الدستور أن أي سياسات قطاعية يجب أن تخضع للأهداف الصحية الشاملة. وأقدر أنه بالإمكان أن نصل إلى هذا الواقع الجميل. اليوم الأطباء شخصوا الحالة وأعطوا الإحصائيات وبينوا العلاقة السببية بين هذه الأنماط من استهلاك الأطعمة وهذه الأمراض الخطيرة، ولكن لا يمكن أن يكتفوا بهذا الدور. لابد أن يخصصوا جزء من وقتهم وجهدهم إلى بث هذه الرسالة في المجتمع حتى تصبح ثقافة متداولة الاستهلاك السليم للأطعمة، سواء كان من حيث تكوينها وأيضا حتى من حيث نمط استهلاكها. اليوم المواطن العربي الذي عوض أن يبدأ يومه بفطور صباح سليم وصحي هو لا يأبه لهذا الفطور، بل يبدأ يومه بسيجارة أو هذا السهر الذي يطول مع إفراط في الأكل إلى ساعات متأخرة من الليل، ثم يأتي النوم مباشرة. إذن أعود لأقول الحقائق العلمية ظاهرة ومقنعة جدا وثابتة، ما علينا إلا أن ننقل هذا الهم إلى أصحاب القرار السياسي حتى تصبح الأغراض والأهداف الصحية تراعى في كل سياساتنا القطاعية. ويجب أن نركز وأن نستثمر للمستقبل، أي أن نركز على الشباب، على التلامذة، على الطلبة، على المجموعات الكبرى في المدارس وفي التجمعات العمالية الكبيرة، حتى نستطيع أن ننقص من تأثير الأطعمة غير السليمة تكوينا وطريقة استهلاك على الصحة العامة في بلداننا، والتي تكلفنا اليوم ميزانيات كبيرة، سواء كان في علاج آثارها بالأدوية والعمليات الجراحية الباهظة، أو والأهم من هذا أن تخرج ذلك الشخص المريض من الدورة الإنتاجية العامة للبلاد باعتباره أصبح شخص يعاني من إعاقة ما. أشكركم على هذا الجهد، وإن شاء الله بعد قليل يجتمع المشاركون في الموائد المستديرة الثلاثة لتقديم التقارير الثلاثة، وشكرا لكم.